Hello. This is the mission 56 organized by Space Analog Station, Habitat Marte. And today we will have a presentation of Sakhaa Almadani from Saudi Arabia about the health center, okay? And then, okay, Sakhaa, now you are the host of the meeting, and then it will be possible you share your screen, okay?
Okay, thank you, Professor. Okay, so hello everyone. This is mission 56 for March Habitat Management. I'm Sakhaa Almadani from Saudi Arabia. I'll be presenting about the health center. Okay, this is the outline of my presentation, the objectives. Okay, this is the basic like outline of the whole facility. Of all facilities together. I'll be focusing on mine, the health facility. First of all, we'll start by the internal design. Excuse my drawing. So we have 3-floor area. The first one will start from the first floor, like the ER. The ER is the emergency room. It's going to be responsible for any emergency cases. It's going to have like the vital signs, the very important things like blood pressure, heart rates, respiratory rate, and temperature. They're going to check those things. Usually they check them routinely anyway. The 3D printer for anything that they're going to need further on for the clinic and OR as well. And the disposal of any waste materials is going to be here and like in an area in this ER, the first floor, and as well any needed tests like blood, urine, stool test equipment. So this is the ER, and then we're gonna move to the clinic. The clinic usually gonna have the physical therapy area, the psychotherapy sessions, the telemedicine device to connect those doctors to Earth, to other doctors in case they needed any more help, and the most common needed medications are going to be supplied there. Otherwise, the rest are going to be manufactured using help from the greenhouse. I'm going to talk about that later. And also a VR headset, which as well can be used in the OR. The OR is the operating room. It's a sterile area. No one can just like go in and out from there. They have to be scrubbed in. They have to wash their hands. They have to wear specific clothes for that. And the OR as well will have a little area on the side. It's going to be like a lab. They're going to use it for investigations, for like blood tests and stuff, and also to help manufacture some medications they need, and pills and injectables. And as well, an X-ray machine in case they needed it for the OR or in diagnosis. Okay, so, and then we're going to talk more about the internal design. I imagine it to be something like very minimal, and everything has to stick to a wall, or like things can't be flying around, especially sharp objects. So like magnets around to stick everything to it, or specific containers for everything. It's going to be minimal and practical. So, and then I'm going to go to applied technologies. What are we going to have here? We're going to have a fully equipped OR, and that's the 3rd floor. We're going to have a small lab in it, and going to have a foldable X-ray machine. And the resources that we're going to need, either from Earth or in situ, are going to be the medications we're going to use for any astronauts who need them, the sterilization solutions, especially for in case of any wounds, if any injury. We're going to need medical devices and equipment of any primary healthcare center, like the device they use to take blood, to measure blood glucose level. That's like a basic thing they need in any primary care center. So we're going to need that in there. And printables for the 3D printer. I'm going to talk more about the printer later in the objective of 3D printing. And management. The organizational structure is going to be, I imagine it to have like 3 three astronauts. First one can be a medical doctor. That could be an internist. Internist is a doctor who is specialized in internal medicine, or an ER physician. ER physician is the emergency room doctor. And a general surgeon, because the medical doctor cannot perform surgery. So we need a general surgeon as well as a nurse. The nurse can aid doctors in both the medical and surgical room. And then the position. So I already mentioned some of it. The medical doctor will be in charge of the clinic and any neurosurgical emergency. So the ER, the first floor, and the second floor, the emergency room, and the clinic are gonna be under the medical doctor. He's gonna be responsible for both of those. The general surgeon will perform any emergency life-saving surgery in the OR with the help of the nurse, of course. And the nurse will be responsible for periodic checkups like vital signs, for example, and assisting both doctors if needed. And the training program. So obviously both doctors and nurses should have registered medical license. They're gonna have to be well-trained and work with the most common space health conditions. In addition to extra training regarding mental health, because as you noticed, I haven't mentioned any mental health specialist because like I want those doctors to have extra training regarding to mental health so they can detect any warning signs of any psychiatric disorder, and then they can be guided by a psychologist or a psychiatrist from Earth, the telemedicine device I already mentioned, to do the recommended therapy or to take any specialized more consultations. And as well, there's an important point that every astronaut should be trained to perform CPR. CPR is cardiopulmonary resuscitation and basic life-saving skills, BLS, in case if a medical staff itself was affected by anything. So they're humans as well, they could get sick or something. So every astronaut should at least know the basics so they can help them. And those are some videos you can watch about surgeries in zero gravity. It's very interesting. Like if you open a patient in like no gravity, the organs are gonna be floating. It's not easy. So they have to have really specific training, and some other videos here. Okay, the resources are gonna need for 1 week. It's very difficult to predict what we might need for 1 week because you don't know what get sick without prior noticing. So I just predicted the most likely things we're gonna need. The first aid kit, obviously, the ready-to-print designs of all needed medical and surgical equipment. The thing with this is, in case of any, like, you're gonna want a device, you might not have it, but at least we're gonna have all printables, like a designs ready to print by the 3D printer. So whenever they need it, they just print it at the time. Present to the health center in case of any health condition. I'm going to talk about most of the medical health conditions. Like they're usually not really an emergency, but they're like motion sickness, headaches, inability to sleep, back pain, and those usually they get prescribed medications. It's an already established guideline. And other conditions like minor traumas or burns, dermatological and musculoskeletal injuries, respiratory illnesses, and genitourinary problems, they can be dealt with in the clinic or OR, depending on the need of each case, of each astronaut. And about the protocols of the health center, protocols and routines of the facility itself. I already talked about it, but the medical emergency, they have to be treated in the ER, the first floor, or referred to surgery if needed. The regular checkups can be done in the clinic along with the physical therapy, psychotherapy. It's like a normal clinic. That's the second floor, and the OR, the third floor, can only allow scrubbed in surgeon, nurse, and the patient. They cannot like no one else can be there without being sterilized, like without, they have to be in a sterile area. And protocols for safety. The OR area has to stay, I keep emphasizing this because it's very important, we don't want any infections, to stay sterile at all times. The surgeons need to scrub in before performing any surgery. The disposal of chemical and biological waste has to be done properly. The thing with this is they're still investigating many more ways to do that properly. They're thinking about usually what they do in long missions, they contain them in plastic and like bags and they bring them back to Earth, but that's not really sustainable. So it has to be another more proper way to dispose of those chemical and biological wastes. And sharp objects need to stay contained in a safe container and disposed of safely after using as well. And the OR can serve as an isolation unit when needed, like because it's an area that's kind of isolated. In case any astronaut needed to be isolated for any medical emergency, they can use the OR for that. Also, there's something very interesting I read. It's a study by Paul CG, and I wrote the study publishers here. They say that usually surgical prophylaxis to remove the appendix and the gallbladder before the astronauts go to space in long-term missions is usually recommended because it outweighs the risk in a normal person, in a normal healthy human. So that could be a safe, like, because if you send the person, an astronaut to space and then they get acute appendicitis or cholecystitis, it could be a life-threatening disease. It's an inflammation to the appendix or the gallbladder, and it could threaten their life if it ruptures or something. So, and it's very preventable basically by removing the organ. And it has some ethical issues, but it could be like viewed as safety precautions to astronauts. Okay, and protocols for occupancy and entertainment. They can use the health center for medical research and projects, and the VR headset can be used for guidance during surgery and in the OR and for psychological therapy in the clinic. Okay, and then protocol for food microproduction. We don't really produce food in the health center. However, we need pills and injectables, and they ideally would be made in the pharmacology lab and with a precursors supplied from the greenhouse and other production facilities. It's not a production facility, it's gonna need help from other production facilities. And the 3D printer. So the 3D printer is gonna be for surgical equipment. And as I mentioned before, it's better to have the printables ready so it doesn't take more time to design them. And medical devices that need adjustment of the size to fit each astronaut. So they're not gonna bring all sizes with them to Mars. So they're just gonna have printables ready to adjust and then print. Materials needed for physical examination, any specific medical device needed for any diagnosis or investigation at that time. Okay, spin-offs, the technologies and outputs that can be applied to Earth is, I really like the idea of the 3D printing. So they could use the 3D printers for surgical equipment and medical materials here as well on Earth. And, okay, and also they can be reusing medical devices after sterilization, and they could produce drugs instead of waiting for resupply. How would the health center impact the sustainability and like the sustainable development goals? It's one of the most important facilities to sustain human life on Mars. Logically, without a healthy crew that is able to function as its best with no medical conditions affecting their performance, it won't be possible to sustain a long-term life in Mars. So it's very important to sustain that life and to have it actually functionally at its best. Those are my references. And these are my personal contacts and social media. And thank you. I'm done with my presentation in case you have any other questions. Thank you for listening.